Hello everyone, and welcome to Your Health, Your Choice. I am Dr. Roopnarine. On tonight's program, we'll be discussing the COVID-19 pandemic and its impact on mental health. With me in studio tonight to provide his expert personal insights is Mr. Hanif Benjamin. Mr. Benjamin is a clinical therapist and a clinical traumatologist, and he is attached to the Center for Human Development Limited. As usual tonight, our numbers should appear at the bottom of your screens, and you can send in your comments and your questions, and we'll do our very best to attend to them in the final segment of the program. So guys, let's get the program going. Let's get down to business. Let's talk mental health, and let's say hello to Mr. Hanif Benjamin. Hanif, how are you doing?
I am well, Dr. Roopnarine.
Thanks for coming on the program.
Pleasure, pleasure, pleasure. In my home area, San Fernando. Yes, indeed.
Welcome back.
Thank you, thank you, thank you.
So, Hanif, this is an important topic that I wanted addressed very early in the year.
Yes.
I really want to start you off with just traditionally in medicine and in society, when we're talking in the community with patients, mental health has always taken a sort of a back step on the back burner. It hasn't been in the forefront. Diabetes, heart disease, strokes, everything else is in the forefront. I don't know if that's probably traditionally Trinidadian culture. We talk about mental health towards the, not really attentive mental health. However, the game has changed.
Indeed it has.
And the pandemic has changed the game. So, Hanif, if you could just tell our viewers or discuss with our viewers and myself, why is it important that in 2022, as we enter into 2022, we're in 2022 now, why is it important that mental health is the focus of the discussion? Why is it important that we put this as a prime objective in our healthcare discussions with the population?
You see, Robin, for far too long, you have said it, mental health has always been a stepchild. It has always been something other than physical health.
Yeah.
The World Health Organization put it in context for us a long time ago.
Yes.
They said 4 in 5 would live with depression. They said that depression would surpass in terms of lifestyle diseases by the millions in 2030.
Right.
It means that mental health must be a priority. And if there was no other time but the present that reminded us how critical mental health is. And during this pandemic, we saw the scourge of mental health as it ravaged the world as we grapple with COVID-19. We saw what depression, anxiety, we saw people who were already diagnosed pushed to the precipice. And we saw people who were never diagnosed with a mental health disease before are now coming in for diagnosis. Not only that, but they must now go on medication because it's that bad. And so when you look at those things, Robin, you see where prominence that mental health must be placed in the middle, in addition to our workplace. For far too long as well. When I did a conference 3 years ago about the hidden cost of mental health. And people were astonished to learn the billions of dollars that is spent on mental health without them even knowing that. How many people come to your office for sick leave because they're feeling ill today? And when you examine them, there is no real physical illness, but it emanates from the mind. And
I think one of the important things as well is that sometimes employers, or sometimes the society, or even the patient themselves, can be ashamed to say that they need time at home because of anxiety or a mental issue. You know, I don't think the rest of society, the employers really appreciate that that mental illness is actual disease.
It's real.
And the patient is almost kind of embarrassed that they even hand it into the employer, to hand it into someone else, to actually acknowledge that they have anxiety, they have a mental issue, and they need some time home to sort themselves out.
And that is the very reason, that is the very reason why people take other kind of sick leave. That is the very reason why some people take no pay leave, because of the stigma that is attached to mental health. But in 2022, Doc, we are seeing where we cannot escape what mental health is.
Yes.
We can no longer escape the power and the pervasiveness that it is ravishing our world.
Right.
We can no longer escape. You see, before when you heard of a suicide, you say, oh, and we cover.
Yeah.
But when you look into our villages, the rate of suicidality, with boys and men,
especially during because of the pandemic.
Of course. In general, you know, suicidality is high, but given the last 2 years, we have seen a significant rise in it. And as you know, boys and men are more likely to commit suicide as opposed to girls and women who attempt. You see? And so I am saying all of this to say that mental health is as real as a cut that you will get.
Right.
And until we recognize and put it on par, we are going to be in problem.
So Hanif, you're a person who practices all over the world. You're trained in the United States as well, and you've been here in Trinidad for a good while now, and you have a good grasp of the society and mental health programs. I just want to put it in perspective so we know exactly what kind of problem we're facing right here. Is our problem with mental health illnesses in Trinidad and Tobago, is it worse than other countries of the world?
No, it's on par. And that's the irony. Because other places in the world have recognized the importance of mental health treatment.
Is it that we're not recognizing and treating as much as the other?
The problem in Trinidad and Tobago is that, one, we are not recognizing that mental health is real. Two, we are not putting the mechanism in place to treat with mental health in a real way. There is too many half pieces, meal piece, or, you know, there is no real way. For example, just today somebody called my assistant and asked, you know, where can they go to get mental health treatment because they can't afford, right? And I can't see everybody who can't afford, although I do a whole lot of it.
Of course.
But the question is, where do you send them? Because they call the hospital, and the hospital said that you have to have an emergency or you need to be referred somewhere. How is that going to happen? Where can a person walk in right now at this time, 8:07, with a mental health treatment?
Right. So I think, Hanif, let's pause on there. I think one of the issues coming up from what you're discussing is that we need solutions.
Correct.
Right. Now, this is a real good opportune time for me to really appeal to the viewers that in tonight's program, I don't really want you only to call in to ask a question, because in this kind of topic, the questions might be limited. But we really want you at home to help us. We want you all to give us your insight, give us your feelings, give us solutions, give us your thoughts, your insights on how we could fix this problem of mental health illnesses, how we could approach it, and what issues you are seeing in the society and what caused them. So we are appealing to you at home to join the conversation tonight. Not really questions, give us your solutions, give us your answers. So Hanif, so we really dealing with a problem that we need to integrate a solution into the mental health crisis that we're facing. Right, so I just want to move you a little bit more into the pandemic itself. Right. Now, this is something straight into your field, given your previous portfolios. The pandemic, and I've discussed it with previous guests, has had a really tremendous negative impact on the children of Trinidad and Tobago. Not really so much in terms of their physical health, because the children have done well in terms of the virus and clearing the virus, but really it's really affected them negatively in terms of their mental health. And I think all parents in Trinidad will acknowledge that.
I agree, 100%.
So if you could just give us, and I've given you the floor, if you could just lay it out first, what is the mental health challenges facing the children of Trinidad and Tobago in 2022? Some of them would have obviously been before the pandemic that we never addressed, and the chickens have come home to roost, or will come home to roost in a bad way.
Ooh, it came home already. It came home.
And some of them would have been exacerbated, and some of them with new problems from the pandemic. And if lay it out first, what are the challenges that the kids of this country face in 2022 when it comes to mental health, and what can we do to find solutions, or what solutions are there?
You broke it down into 3 ways, and I like that.
Okay.
And I like the way you broke it down, because you spoke about, and I will address firstly, those children who were living with an undiagnosed diagnoses.
Correct.
So what we would have recognized, Robin, is, okay, let me back up. Children communicate 2 ways, and 2 ways only. Through their emotion and their behavior.
Yes.
That is the only way a child will communicate.
Exactly.
But what we saw was bad behavior. We interpreted a child's emotion or behavior to be bad behavior, negative behavior, wayward behavior. We did not take into account that that child may have been living with some type of undiagnosed mental health challenges or some trauma untreated. And what we saw was a response to that behavior, you see. So let me
Brought
now...
on by the pandemic?
Well, no, in general.
In general, okay.
In general. But the point you made in terms of the three categories, the first one being those children who were never diagnosed.
Yes.
And so what the pandemic did, it really brought to bear that mental health challenges that they had.
Yes.
So you started to see the depression in real.
Yes.
Now, let me back up and also say, in the pandemic, I have seen over 200% increase in children at my practice.
Wow.
Over 200%.
Wow.
And I'm talking about children who have never engaged in mental health treatment
Of
before,
course.
having to go to the ends of medication.
But that's not necessarily a bad thing. Because
It's not.
Because that means the parents are recognizing that they need to help their kids.
Well, two
Maybe-
things there.
Yeah.
Two things there. And that's the paradox we have here.
Yeah, tell me.
One, a parent may recognize that their child needs help
Yes.
and bring the child for help. Or
Yeah.
two, the situation has become so bad, parent-child
Nobody can
relationship.
Has broken down.
Correct, that you have no choice but to
bring the child.
You see, so when
Okay.
you look at it from those two perspectives, and so I have seen where a concerned parent would bring a child because my child isn't eating, my child is not sleeping well, my child is isolated, my child is depressed, my child is crying all the time,
Right.
my child is failing at school.
Yes.
And you have the other scenario where the parent bring the child in, I can't deal with this child has no behavior, this child is a bad child, and so on two ends you're seeing what's going on.
Yeah.
But either way, Robin, the mental health has pushed those who were on diagnoses into the forefront.
Yes.
It has brought up those people who were diagnosed and are now exacerbating.
Yes.
And we also saw where people who have never engaged in any form of mental health treatment are now coming to the fore. And I think that is what the pandemic did. It showed us now there's also a nuance that really bothers me, because school used to be a safe place. So a child who is experiencing sexual abuse, physical abuse, domestic violence would go to school during the span of the day and have a little escape for that period.
Yes.
But with the pandemic having to stay home, they lived in that for 2 years. And I'm worried, Robin, today I am worried that those children who would have been abused over and over the last 2 years, because you see, school used to be the place you could have tell a teacher, you could have tell a friend, but you on the Zoom and everybody home.
Yes.
So you can't say to your teacher, I need help. And so immediately, just this morning on another frequency, I said immediately for the next 3 to 4 weeks, all we should be doing in school is trying to work on the mental, emotional, and social health of our children.
That's a good solution.
Yes, because they would have been inundated over the last 2 years.
Let's forget the academics a little bit.
Yeah, a month. But of course, we are so credentialized and examinized or whatever. We running into SEA, we running into CSEC, we running into CAPE. So we are not pausing to handle the mental health fallout of our children. For example, Robin, during the pandemic, you had online school.
Yes.
But you had children who never had a device.
Yes.
You had children who had a device and never had internet.
Yes.
You had children who had a teacher and some never had a teacher. You had children who were supposed to collect a packet but they can't. You had people who collect a packet but mom and dad can't read to help you to do anything.
In other words, a lot of kids were left behind.
Left behind. That is traumatic in itself.
That's tragic.
But here, what is the worst trauma? They're all in the same class today, with a child who had a teacher, who had extra lessons, who had internet, who had a computer. So the disparity in the classroom today is real. What is that doing to the mental health? So when you talk about the impact of the past, this is the present now. That here, socialization, ill socialization, how are they socialized over the last 2 years? Because as you know, as a child or adolescent, the primary focus is on socialization.
Of course.
But that didn't happen. And now they were so socialize online.
Yes.
So they play a lot of games. They communicated via the social media.
Yes.
So now they are reclused. So now they don't go outside. So we're talking about other physical health challenges coming on. And so that is what we are dealing with. And that is why I strongly want to recommend that the next 4 to 5 weeks is spent, at least 50% of the time spent in school is spent treating with the child's mental well-being.
You see that solution you put forward there, Hanif, I would tend to agree. And it's actually the first time somebody has really laid it out and spelled it out. And I agree. I think the next few weeks or next, I mean, not that we have any, not that we are the authorities, but I understand your opinion and I agree. And we just want to hear what the viewers think as well. So that is a real solution to helping kids. Let's go back out. Let's just play. Let's get to know each other again. Let's interact. Let's talk. Let's put a little bit of the academics a little bit to the side. Which might be difficult.
No, but you can still do it, you know. That's what I'm saying.
Yeah.
Like all over the world, Robin, they have gotten accustomed to what this is.
Yeah.
But we are still grappling with this as if it's first time.
Right.
This has been tried, tested, and proven through. The people are back out.
Yes.
We are still behaving as if this pandemic is
like it's 2020.
Yeah.
Right.
And Robin, you see, I
Game
made a
change,
point.
time to move on.
And that is the point I made.
Yeah.
Even as I talk to the media and talk to people in 2022, I have also changed the way I operate.
Me
For
too.
example,
Yeah.
we are still operating as if we are in a crisis.
Yes.
We are no longer in a crisis.
No. Agree.
We must move to survival.
Exactly.
We have to learn to live with it.
Prospering in the new world. I think that points back to what a few of our previous guests have pointed out to, professors and long-standing community physicians and so on, and pediatricians. The pandemic, no, it's not over, yes, but we can't live in fear. We are seeing an easing, right? We are seeing variants that have become less aggressive. We cannot live in fear, and we cannot live like how we lived in 2020.
Crisis mode.
Cannot live like that. We must plan and strategize to move forward, and we must return as quickly as possible to normal life. And we can get as normal as possible, given the fact that there is still COVID, because COVID is not going to go anywhere. The coronavirus is not going to go anywhere. And in fact, many countries around the world have now deemed it an endemic, and they're moving forward. And it is critical that kids move forward, because as I pointed out when I started the discussion, it might not have, the pandemic might not have affected them as critically in terms of their physical health. So why are we holding them back?
Correct. Now let me show you. There are 4 points I developed that I want to put forward, you know, for the authorities, for parents.
Go ahead.
And the 4 points is really an audit. I call it an audit with your child.
Yes.
Right? I like that, an audit with your child. I like that, you know. Somebody write that down. We could have a conversation on an audit with your child.
Yeah.
And I look at 4 areas. The first one is your academic audit.
Yes.
I need for parents to do an academic audit, meaning, where am I?
Yeah.
Where is my child right now, realistically?
Yeah.
Where are they in terms of the exam? Where are they in terms of their levels, their understanding? Right? So we need to examine that.
Yes.
The second audit is the audit in terms of our mental and psychological well-being and emotional well-being.
Of course.
Where's my child? How are they? How have they fared over the last 2 years? How do they feel? What do they feel? That's the second audit. The third audit is our social and environmental audit.
Right.
Because we must agree that socialization would have changed over the last 2 years.
Of course.
So we must now understand, who are my children friends? Where are they? What are they? Our children would have picked up people along the online world.
Right.
People who might be nefarious, people who would have been all kinds of things. So what exactly is the environment that my child is living in and is now going back to? And that's the third one. And the fourth one is really an audit in terms of life in general.
Right.
Because too often we just ask the child, are you okay?
Yeah.
But what is, are you okay? Even when as a doctor you ask a patient, you want the patient to tell me about this part of your life, that part of your life, this part. Break it up in a way. And too often parents say, well, I can't talk to my child, I don't know how. So tonight, from an age-appropriate perspective, you start to speak to your child deliberately about these 4 areas. You break it down. And the number one thing here, though, allow the child to speak.
Exactly.
Without punitive sanction. Allow the child to express how they feel. And not just express how they feel, but you as the adult act on how they feel. Not make them feel that they are wrong for sharing, or when they share they're going to be punished, but you need to acknowledge how they feel in a real way. Because all through the pandemic, a lot of problems we had with children and parents is the parent don't think that the child had any real problem. You ain't walking no way, I had a,
or the parent might have been caught up in their own...
Thank you.
Because it was extremely hard.
Correct.
So Hanif, sorry to interrupt you, but we're going to have to take a little break.
That's fine.
All right, so guys, we're going to take a little 2-minute break. We're here with Mr. Hanif Benjamin. We're discussing the mental impact of the pandemic. What is great so far is that Hanif has been able to give us practical guidelines. He's not just talking about a subject. He's given us practical, useful home tools to get towards the solutions that we need. All right, so I'd encourage you at home, give us your feedback, let us know what you think. All right, so we're taking a 1-minute break and we'll be right back.
ACTN The Voice launches a new and versatile culinary series called Stacy's Kitchen.
Hi everyone, welcome to Stacy's Kitchen. And on today's episode of Stacy's Kitchen, we will be cooking up a Thanksgiving feast. Our rolls are ready and looking yummy. There's nothing like a good curry chicken and some basmati rice. So I'm gonna start putting my wings in to fry.
We will showcase how to make tasty international cuisine with our local products. We emphasize meals on a budget with our selected ingredients.
Restez à l'écoute, Stacy's Cuisine. Au revoir.
So you can put how much, depends on how big you want it. So our fish is ready. Oh my God, look at that. Oh my God, oh my God. Just like paratha, this is lovely.
Join us on ACTN on Monday evenings at 6:30 p.m. Don't miss Stacy's Kitchen, exclusively on ACTN The Voice.
You're watching ACTN The Voice. Connect with ACTN The Voice on Facebook or Instagram at ACTN The Voice.
ACTN The Voice, your family-friendly station.
All right, guys, welcome back. We're here with Mr. Hanif Benjamin, and we're talking about mental health and its impact on the pandemic. Hanif, just before we broke off there, you were giving us an audit that us parents could use on our kids to assess their status at the moment. If you could just recap that, and then we can move forward.
Right, so I think not just parents, teachers, anybody who is in charge of working with young people, I think it is important to pay attention, and I call it the child audit.
Yes.
So you want to audit, of course, your educational aspect of life. Where are you in terms of your education? You want to audit your mental, psychological, emotional health.
Yes.
What is that? What does it look like? How do you feel?
Yes.
Right? The other area we want to look at is your social and environmental audit.
Yeah.
What is going on in your social life?
Right.
Friends, because you remember, there are students who would have passed that essay and have never physically seen a teacher or their friends in 2 years.
Yes.
And so this week would have been the first time. What does that look like? What does that feel like? And so then you want to do an overall audit in general, and you want to have that child's voice very prominent in how they feel.
Okay.
And I want parents to act on it,
right,
in a positive way, so that we can help children to maneuver what they are going on. And ever so often, you could check in with an audit just to make sure,
right,
and to follow up and follow through.
Yes.
Are you still feeling the way? Are you still this? Those are going to be important and critical areas.
Okay. So, Hanif, that's good. You give us a little audit. You tell us about how we could assess our kids. But what are the other mental health challenges that we as a society are going to see from in this age group in the future, and why we need to step up the game?
Anxiety.
Yeah.
Well, of course, anxiety and depression are two most common mental health diagnoses.
Yeah. I suppose we might see a lot of antisocial behaviors as a society.
Well, we're coming to that too.
Yeah.
And that is part of the whole
We've been seeing
anxiety.
it in the past.
Of course.
We see it now.
Yes, and worse yet, children who have been cultured so much online in the last 2 years, how are we going to break them out of that?
Yeah.
Because I have issues today. Children went to school on Monday, and parents are calling me already today to tell me about the difficulty of breaking that habit of the screen, right? Because they have been so accustomed to playing and stuff like that.
Yeah.
So they prefer to sit in their room and do that.
And if let me just ask you a real direct question. How valuable was that screen time that we did teaching over the last 2 years? In my personal opinion, I don't think the kids learn much at all.
You see, that is why I'm always as controversial as I am. Because I said it at one place on a different frequency.
No insult to teachers and everything.
Of course not.
But I really don't see the...
I call it criminal.
Yeah.
That is the word I use to describe what we did to children.
Yeah.
I understand that we were living in a difficult time, but I also know, and I also believe, that after 6 months of online school, we should have had enough data to see that what was before us wasn't working.
Yeah.
I believe that after 6 months, you should have already collected data from all your school and changed the system.
Right.
There is no reason, Robin, why children should have been sitting from 8 to 2 and 3 every day behind a computer. That, in my view, was criminal. I believe that
I find it difficult to do it.
As do I.
can't do it, you know what I mean, after 45 minutes.
That's difficult.
You have doctors who can't do it, you have professors who I've spoken to who can't do it. How could you expect 7-year-old kids to... And the teachers as well, the more teachers have to teach
preschool children,
kids,
before 7.
So I think what you're getting at there, and if I could break it down, is what you're really saying is that, yes, we had to do something because the emergency was upon our hands. However, when it comes to mental health and the health of your children, us as a society, we need to be responsive, and we need to, on the ground, we need to be moving quickly.
That's correct.
And we fell short. I mean, let's fess up. This society fell short during the pandemic of reacting quickly enough to address the needs of people, especially kids. And we should have seen how things are going quickly and adjust it and open up and close down and probably stop different things.
I think we were so
adapting.
busy trying to fix the adult world, like in everything else. Robin, let me tell you something. If we do not understand that children are our priority, first and foremost, then we will always be playing catch-up as a society.
All right, let me ask you this. Who was the voice of children during the pandemic?
That's the problem. Probably me and a few others.
Exactly. The other part is in a society, we talk about stakeholders in the pandemic, right? Sorry, this might be a little bit outside the realm of the discussion. But geez, I mean, who was the stakeholder for the kids? You'd expect a 7-year-old to get up there and stand up and give a long speech or address the media or address the Prime Minister. Who was really the stakeholders for the kids? And I asked myself that before this show, and I came up with very few names. Obviously, yourself is on that. And I think Dr. Bratt was one of the other persons who I'd put alongside you. But there were very few people who actually were stakeholders of children. And when your voice is quiet sometimes in a society as ours, you get ignored.
Yes, and we saw that because for too long, I am firmly of the view that after 6 months, we should have changed our system. You have my 5-year-old nephew on a computer learning about the Red House, and I'm saying that this can't make no sense.
Now, in terms of education, Hanif, right, the curriculum was based on, and how it was based on students being in
brick
school.
And mortar.
Can you explain that to us?
And I keep making the point, it wasn't online learning.
It was never.
It was a curriculum that was designed for a school that was delivered online. And the emphasis was exams, push exam. And unfortunately, as we're talking about the students, the teachers as well, they were under enormous pressure to fulfill mandates that were unreasonable and still are unreasonable in some respect. And I think that the mandates just led people to just whatever it is. So you come, you do what you need to do, and you keep it moving. But the question is, who suffered at the end? Our children, unfortunately, were on the receiving end of the stick that wasn't so clean.
Yes.
You understand? And so we continue to see that. And so I remember I had a young girl who came for therapy. And she told me that 11 o'clock right, the teacher sent work and required it to be done by 8 o'clock the next morning.
It's a job. It's hard.
And so she was asleep and she missed. Now the reason why she was with me is because of the level of anxiety. A brilliant young lady, but could not adapt to the online world. When she saw that miss work and was berated for it, she could not sleep after that because she was so fearful that she would get work in the night. What are we doing to our children?
All right, and if let's suppose in an ideal world that you were in charge of setting the curriculum during the pandemic and children's learning, how would you have done it? It's easy to criticize and hindsight, and 2020 is 2020 vision, but how would you have done it?
Well, you see, the thing is, the good thing with me is, well, I don't use the word criticize no more. I don't use feedback. Right? And the feedback and the thing about Hanif E. Benjamin is this: every time I put something on the table as an issue, trust there are 5 solutions behind it. That is how I operate. That is how my staff operate. Don't ever come to me with a problem unless you told me we had a problem. And if you had a problem, did you address it? And if not, you're coming to tell me about how you fix it, or we could look at solution. That is how I operate.
Well, give us a solution.
So what should have happened here, in my view, after you do your assessment, we recognize where we were. I am saying that the day should have been broken down probably into 2, 3, or 4 hour days. Right? As opposed to 6, 7, and 8 hour days. So by lunchtime, these children shouldn't be in any computer class. I think more of project-based work, project-based learning should have been done. I think more Zoom or whatever platform you use, group setting with students should have been encouraged. So students would have been meeting with other students via social media so that they could do their group work and stuff like that. I also believe that helping children who are not or had access to these computers was also important because we're dealing with a population who, some people who are functionally literate. Let's not play. There are people who do not know those kind of math and English and science, right? So we should have set up a buddy system where we help those parents who could not. So we set up a tutoring kind of arrangement.
Sorry to interrupt.
Go ahead.
I have to make this point, all right? Because I'm a doctor, I'm frontline, so to speak. I have colleagues in the hospital who are really in the frontline. They were out of their home. Who's going to look after their kids? So they have to leave their kids with grannies and grandma. And grandma and grandpa, I mean, come on. I mean, they try the best, but they're not the best ones to help with the technology and to help the kids.
Correct.
And they have their own issues as well. So that was a big problem. Sorry to interrupt. I need to make that point that a lot of frontline staff, the kids who are at home, left unattended or with the grandparents, and therefore they may have suffered. Continue on, sorry.
And so, yes, and so in addition to, I would have created that tutoring type of scenario where children who did not have the privilege of having a parent who can readily help them, but we would have instituted. There was a lot of OJTs as part of the school system. I would have utilized them to be having smaller, more intimate class time as opposed to a big class. Teacher, I'm a lecturer.
Good point.
And when I have a class with 30 students in it, there is no way I can maneuver 30 people on a screen. So I use breakout rooms.
Feel of whether they're learning or not.
So you break it down, so you have classes throughout the day, perhaps, you see, and you have days off. So those are some of the things I would have done to encourage a more relaxed kind of environment and help students along.
All right. So, Hanif, moving a little bit away from the educational system and the kids as well, right? This is real practical, real-time advice here now. Close to 3,500 citizens have fallen to the COVID, right? To the COVID virus. But this is something I'm seeing in my clinic. I mean, sometimes a patient comes in and said, Robin, you know, mom died from COVID. Sometimes they come in and say, I mean, I see it all the time, they come in with tears in the eye. My husband died from COVID yesterday. Every family knows somebody who might have died or been affected by COVID at this point in time. Let's get real, right? It's widespread. Everybody knows someone who had got COVID or themselves got COVID. How would you, Hanif, in your practice, in your clinic, right? Because you run a clinic, how would you approach and help patients who have lost a loved one to COVID?
You know, 2 things come to mind right now. and I've been doing this a lot.
Yeah.
And the first thing is complex grief.
Yeah.
Because grief is a natural part of the process. But what you are talking about here is complex grief, because you engage in life, you get sick, you go to Cora, you go to Cuba, and I don't see you again.
Yeah.
And in the early part of the pandemic, you wasn't getting the body.
No.
Right? So there was no closure.
No closure.
So that is what we call complex grief.
Okay.
Where this grief can turn into a mental health diagnosis if it is not managed well.
Good.
The complexity of the grief is where you had no closure, it was sudden, it was traumatic, everything that is the pandemic. And we have, as you say, over 3,500 people who have succumbed. And if you were to multiply, and if you were to multiply that one person and the people that surround them, you're talking about thousands of people who would have been affected.
Of course. So
in essence, it is almost safe to say that as a society, we are grieving. And that, coupled with all the other kind of societal ills we have going on now, continue to create a complex situation. What I say to my clients in the first instance, allow yourself to grieve. Allow yourself to grieve. We are not allowing people to grieve in any real sense. We need to allow them to acknowledge how they feel. Feel angry if you want to. Feel whatever you want to feel. But let us acknowledge that you are feeling the way you are feeling. Let us put systems in place to help you. And it brings me to something that I've been talking about for quite some time, which is a trauma center, you know, in Trinidad and Tobago. Again, trauma is real, the pandemic is real, and we should have already opened trauma centers where people who experience this kind of trauma can come and meet with people like myself and or other colleagues to help. So one of the things I'm planning to do,
away from the mainstream hospital system.
No, because
it's a particular center, a particular location.
Correct.
Away from the hospital system, because it's maybe not the best location for
people. Well, it's not. Stigma and all of that. I know that NCRHA would have started a stress clinic out of Chaguanas, and I know that was overrun because of the amount of people that was requiring it. Yes. And remember, you can't just walk in the hospital and say, well, I stress and I grieving and I want counseling. It don't work like that. So where do you go? Yeah. If we create these trauma centers where we can meet with people and treat with what is going on, Robin, the next year and a half is going to be harder. And I keep telling people, if we are not planning for 2022, 2023, we're going to recognize where we are as a society. People are going to start to get more ill physically and mentally. We are going to see more job losses. We are going to see more people who are getting, stressed out on their job, taking more sick leave. We are going to see, because people are not dealing in any real way with the trauma that they are experiencing.
Right.
And so if we create national trauma centers, right, and I say, listen, let's utilize the health centers, we have it already.
Yeah, exactly.
Let's utilize the health centers. Yeah. We could do sessions 4 o'clock in the evening, health center closed. Yeah. We could do sessions on Saturdays to help people to come in group session. Yeah. You understand? We could do sessions via school buildings. We have all these monumental school buildings.
Right.
Let us do that.
So let's pull you back towards the actual patient itself, themselves, Hanif. What are the stages that you take someone through? How do they move from being traumatized by the death of a relative, a husband, or whatever, well, any other relative, to moving towards some sort of normalcy? I understand the trauma center is a great idea. That's a great solution. But what happens when they come into your office? And how would you move them to that safe zone?
No, and that is what I like, the safe zone. Yeah. Because the word normalcy there's nothing called normal.
Of course.
You could never.
It was a poorly chosen word.
But that is something that people always say. You hear it from the highest to the lowest. We have to get back to a sense of normalcy. No, that you have to create a new normal.
Exactly.
And that is what I help you to do.
Right.
I help you to create a new normal with the absence of this person. So the thing that I do, I go through complex grief with this person. I first of all delineate whether or not depression or anxiety may have stepped in already. And that's okay if it did. And I want people to understand it is okay to not to feel okay. The problem is when you decide to live there.
Exactly.
So I need to move you out of that. So how I do that, I process with you. what would have gone on, because people who are going through complex grief, they don't talk about how they truly feel. I give them that opportunity to walk through and process how they feel, what they feel, whether that feeling is anger, whatever it is. And I help them to now turn that feeling into resiliency, how to move it forward. And I tell people all the time, let me tell you something, this ain't going to change today or tomorrow. Even if you see me for 3 months, you are going to feel pain, and that is okay too. The issue is, my job is to ensure that you do not park up in depression and anxiety or on the extreme suicidality. You understand? And so that is what I do. I walk you through complex grief. I help you to process what has and is occurring around you. And more importantly, I help you to create a safety net around you. So I bring in the people in your social environment. Who are your support system? What is going on? Because when people are dealing with complex grief, you find that they don't take care of themselves. So they don't eat right, they don't sleep right, or they turn to what I call the feel-good mechanisms. So we turn to alcohol and drugs and risky behavior and all of those things. So I help you to process that, to not end up in that circumstances. But the reality is, we have to do this where the understanding is that you have just had a tragic loss. And you must now move on with your life. How do you do that? So I don't even presume to tell you, hey, wake up and shake it up and get it moving.
All right, Hanif. Cool. So we're going to take a next break. So guys, we're going to take a next break. Please let us know your feedback on what Hanif is saying here tonight. Please, we'll take 1 minute and then we'll be back.
ACTN The Voice launches a new and versatile culinary series called Stacy's Kitchen.
Hi everyone, welcome to Stacy's Kitchen. And on today's episode of Stacy's Kitchen, we will be cooking up a Thanksgiving feast. Our rolls are ready and looking yummy. There's nothing like a good curry chicken and some basmati rice. So I'm gonna start putting my wings in to fry.
We will showcase how to make tasty international cuisine with our local products. We emphasize meals on a budget with our selected ingredients.
Restez à l'écoute, Stacy's Cuisine. Au revoir.
So you can put how much, depends on how big you want it. So our fish is ready. Oh my God, look at that. Oh my God, oh my God. Just like paratha, this is lovely.
Join us on ACTN on Monday evenings at 6:30 p.m. Don't miss Stacy's Kitchen, exclusively on ACTN The Voice.
You're watching ACTN The Voice. Connect with ACTN The Voice on Facebook or Instagram at ACTN The Voice.
ACTN The Voice, your family-friendly station.
All right, guys, welcome back. We're here with Mr. Hanif Benjamin, and we're talking about mental health. So, Jazz, if you have any comments, you can put it up there, please. Any messages, any questions, and then we'll get back into the into bereavement afterwards. Hanif, don't you agree that the parents need to recognize they're the first teachers, and they need to focus on the social interaction safely now during this online learning? Don't you agree the parents need to recognize that they're the first teachers and need to focus on the social interaction safely now during this online learning? What's your comment on that?
Well, they have always been the first teacher, but I am one who again, you know, the whole Haralam was in sociology in terms of what the primary, and I don't really subscribe to that because children spend an inordinate amount of their waking hours with somebody else. So we are all teachers. We might be asking a parent to do something that they are not able to do. So we may have to provide guidance to them. We're asking a parent to be this teacher that they have no clue how to be.
Being a teacher is not an easy thing.
It is not.
And it's a calling as well. It's a profession. And not everybody can do it. And a lot of people learned that during the pandemic because people were all in the past were very easy to criticize teachers. And very easy to criticize teachers. But now a lot of people, I think, realize.
As a matter of fact, I did an article at one time and I said teaching is one of the most difficult profession.
It is very
one of the most difficult, if not the most difficult profession.
Especially age groups.
You're responsible for a mind.
Yeah, boy.
You are responsible to shape a mind. As a matter of fact, most of these primary school students, first, second, the first person they want to become is a teacher because of the impact. And that is why I say it is so critical. How you are as a teacher will resonate with me for the rest of my natural life. Teaching is one of the most, if not the most difficult. And that is why I always tip my hat to them. Because they have to watch television and say, boy, I had this child in my city, he's now a criminal. Or I had this boy, he's now a traumatologist. Or I had him, he's now a doctor. I shape his mind. I created a safe environment where he could have learned and develop and grow. And during the pandemic, it was brutal for them as well. Because you have to understand that a teacher was also a mom, a teacher was also a dad, a teacher also had an elderly parent, a teacher also had to teach and examine 3 of their children in school as well, different age group at different school, where a teacher getting 5 devices in one home at the same time. So I said it was a difficult task. But to go back to the point, I think we are all responsible. And I like to look at life like a pie, like a pizza. When you order a pie, you know, a medium, you get 12 slices in a box. You don't ever go and get 11 slices. There's a reason for that. And even the box that we discard with such a veracity is very critical. As a matter of fact, the most critical. You don't ever go and pick up a pizza in a plastic bag, but yet we don't pay attention to the box. We are all responsible. And if we are all responsible, we all take responsibility, then all of us will move forward as a society.
Very good, very good. Jazz, we could take the other comment as well, please. The parents think learning is for teachers only in school, and I believe this structure now needs to have the parents realize that they need to take their roles as teachers too. I suppose a bit of that point we would have explained it in the previous discussion there. So, Hanif, if you could just go back to the bereavement. So we have close to 3,500 people who have lost their lives. We have the whole society is impacted, a lot of their relatives. So you're saying that a good suggestion would be to open a trauma center where people come in and we see them, and then you try to move them through the stages in your clinical practice. Try to bring them to a safe zone, and it doesn't take. It's not right away. It takes a while.
But while you begin to do that work, again, helping them accept the reality of the loss, because a lot of people are stuck in that place of where it's not real. They are still hopeful. Right, and that in itself brings about a level of its own depression and anxiety, because you're sitting hoping for something that will never occur. You're talking about allowing themselves to experience the pain, and that's what I'm saying. I want people to experience the pain. And I remember when I wrote after the fire, I said, allow people to grieve, allow them to feel the pain. Stop telling them it's going to be all right and God knows best and this and that and the other. You stop it. Allow people to feel the pain in a real sense, because then
Don't try to quash it.
Of course. No, we can't, because they always try to minimize it and partialize it and cover it up. No. Allow people to feel.
Try to pull you too quickly.
Yes.
To say, no, it'll be back, you had to get off your feet. You have to go.
Oh my goodness.
They don't allow the people the time.
Correct. So allow them to feel the pain. I tell a woman in my office the other day, I said, let me tell you something. There's a safe space. Bawl. I said, well, she said, what do you mean? I said, from what I heard from you, you just want to scream. That woman screamed and she cried and she screamed and she cried. And I'm like, whoa. After that session, I was so tired. Because she didn't get chance because her brother died, and so now the children are pseudo, now her children, and she just was tired, and the work wasn't very forgiving. They wanted her back to work, and how long you're going to stay home, and they're not understanding the complexity of her environment, and she just needed to scream because she never felt the pain and the hurt of losing someone. You know, and the other area, and I spoke about it, is helping them to realize that this person is no longer here. And we must now begin to plan around that and to develop other healthy relationships that is going to help them through this difficult period.
Okay. So just to move on a bit there, Hanif, on the other side of the spectrum, we talk about the kids, we talk about those who have lost loved ones. On the other side of the spectrum, which I haven't really been hearing much of, is a lot of elderly people have suffered during the pandemic as well.
I spoke to that at length, Doc.
Okay.
I spoke to that at length.
Give us your opinion on that.
Because what I did, if you were to go to my social media in the early, I did some lives.
Right.
And I broke it down because everybody always lumping everything into one.
Correct.
And I said, no. When you look at depression in a child, a depression in adolescent, depression in a teenager, a depression in normal age people, a depression in older, are totally different. The pathology or the symptoms, meaning what you look for, is very different in every age group across the lifespan. And you cannot treat a child's depression the same way you will treat an elderly depression.
Exactly.
You see?
So one of the issues that we discussed previously on the program is that we highlighted that elderly people are, everyone, loneliness.
I commented that.
And that is something that we never really used that as a medical diagnosis before. But I am thinking loneliness is a medical diagnosis.
You know, strange enough, let me just go academic with you real quickly for a minute, if you'll allow me.
Yeah, of course.
One of the things I've been saying to my colleagues in England and America in trauma, and it's a conversation that I'm pushing, that we may now have to rethink how we diagnose trauma. Because what the pandemic did, it changed trauma 1, which is sudden and immediate, trauma 2 supposed to be prolonged. So now we move trauma 1 into trauma 2 into complex trauma. We may now have to come up with another category to capture that. Just like you are saying here, that you may now look at a new diagnosis in terms of loneliness as a real thing. Because I tell you this, loneliness has so much impact on the mind. Generally, our elderly parents, family members are lonely because they don't like to be a burden. Are you all right? I good. Right? They don't like to tell you unless you recognize something is going on with them. They don't like to say, I am feeling unwell. Just like my mom. Good night, mother. Right? She don't like to say when she's feeling unwell. You have to recognize that, hey, but something ain't right with mom. But we're so busy with life, Robin, that we don't always pay attention when something changed in their environment, where they're eating less, where they're sleeping less, or where they're sleeping too much, or where they're over-medicating themselves. And over the pandemic, I focus specifically on the parts of the lifespan. And the elderly, I peg them out because they are the forgotten ones. And early in the pandemic, we heard a lot of, they are the vulnerable. So that pushed them further and further away from people. And so you found that their grandchildren, who they used to give them the life of the day, the joy, was no longer interacting with them. People had to be isolated because we want to protect the elderly. So now our elderly persons would have been isolated even further to being already isolated in general, being an elderly person. So I always remember, when you go to the clinic in San Fernando, your hospital, you're meeting your friends, or you're going to the Y, or you're going somewhere. All of that cut. And the biggest one, church. Right? Church was an event for some of our elderly, and that was removed from them. And so the depression became real. And so I asked people to pay particular attention to yes, we want to protect them, but you had to create ways to get them involved. We had to create ways to help them to understand that they are cared for, and we love them.
Agreed. So Jazz, probably next question there, or the next comment. Do you have any insight on the recent return to, what's that?
M-O-N-K, I don't know where is that, the Monk Movement.
Do you believe that this can help with our current mental health crisis in Trinidad? All right, so I'm not familiar with it.
Well, I don't know that we have, I have never, the monk, but based on what I'm hearing, monk meditation, that is the only thing I know monk for. Okay. You understand? But I don't know.
So if you're not really familiar with it, yeah, so we really can't comment on it. Mm-hmm. Yeah, please. Excellent topic. Great show tonight. My question concerns our grandparents, our elderly population. To Mr. Benjamin, have you also seen them suffering from depression and loneliness when it comes to the lack of socialization with their families?
See, we're now addressing that.
Well, we're certainly addressing it now.
Mm-hmm. We are.
Right.
And I have seen it significantly. Again, I have seen more 70, 80 years come into my office.
Yes.
And I'm like, why are you bringing grandma here? Mm-hmm. You understand? Because they say grandma just stop engaged with life. She just there, we don't know what's going on. And I said, have you ever considered depression? So I said, tell me about your social environment. And that's the beauty about being a clinician like I am and others like me. We're no longer just interested in the individual, but we concentrate on what's going on around the person. So I was able to examine the entire environment, and I was able to help them to restructure how they live. And in 1 month time, grandma was back on her feet, bouncing all over the place. Right. But grandma was suffering in silence. Right. And she wasn't eating because grandma was very worried about her children out and about and getting COVID and death and dying. And grandma was spending an inordinate amount of time watching every piece of news everywhere in the world, whole day and whole night. And so I said, you know, you had to curtail that. I said you had to have almost like a screen time that you will give to a child. Yeah. I said you had to have a screen time for grandma too. Exactly. And then I said, what about creating activities with your children that was safe enough but can include grandma, because a lot of things were planned without the grandparents because we thought that we don't want to carry them out because of the burden and the this and the that. I said, can we incorporate them in things at home? Can we ensure that at least they go and they take a little walk where it's necessary? Exactly. So we had to recreate our system because they were suffering, and for many continue to suffer in silence.
Exactly. And if, strangely enough, the hour has flown by. We have about 2 more minutes in the program. So I would just like to firstly thank you for coming on the program. I would like to compliment you because it's not an easy job, and I think you're one of the few people that can do it, to not just talk around a subject or describe what they see, because many people could do that. But you have actually analyzed what is going on, you have diagnosed the problem, and you have given step-by-step solutions to a problem. And that's not an easy thing at all to do in mental health. And I must compliment you on that.
I thank you.
And I hope in the future you could come back on board again.
Anytime.
And you can give our viewers some further insights.
Anytime.
All right.
It was a pleasure chatting with you. I really enjoyed it. The hour flew.
It did.
And this is what I do. This is what God has put me here to do.
I believe so.
I do it every single day without fear, without favor, because I believe in helping mankind. I believe in moving people to a healthier life. And once I can do that, even if it's on this forum, I will be more than happy to. All right. Thank you for having me.
You're very welcome, Hanif. All right, guys, thank you very much for tuning in tonight. I hope you enjoyed the program. It's more of an educational program tonight. We learned a lot. We tackled a very difficult subject, and Hanif gave us some great solutions. So thank you to everyone at home. Thanks to you who sent in the messages. And yeah, to everyone, have a pleasant evening. Have a great night, and we'll see you again next week. Take care, everyone. God bless.